We'll start with atrial septal defects. This image shows the normal aspect of an atrial septum with the thicker secundum septum, the primum septum, the fossa ovalis, and showing again the same image on the left side, and an atrial septal defect on the left side. This nicely shows the difference between a PFO, where we don't have a tissue defect. It's an overlap between primum and secundum septum, so more like a valve. And in an atrial septal defect, by definition, even if it's a small defect, we have really a tissue defect within the septum. Atrial septal defect is a relatively common lesion, about 20%, and what we end up with, having a hole in the atrial septum, is that we have, in normal circumstances, a left to right shunt. And this is not caused by a pressure difference between left atrium and right atrium. It's basically due to the fact that the right ventricle has a much better compliance than the left ventricle. And this is the reason why we have shunt from the left atrium to the right atrium. If we have reduced compliance of the right ventricle, for example, because we have in addition pulmonary stenosis and right ventricular hypertrophy, this reduction in right ventricular compliance will cause a reduction in left to right shunt, and may even cause right to left shunt if we have severe hypertension in the right ventricle. Any other additional lesion changing the pressures in the left and the right atrium again will change the flow. For example, a mitral stenosis will increase left atrial pressure and will therefore increase left to right shunt. Now, the consequences of this left to right shunt are that we have right ventricular volume overload, we have pulmonary overcirculation, and in at least some of these patients, this will cause in the long-term pulmonary hypertension. It's less frequent than in shunts on ventricular or large artery level, but a small percentage, about 5 to 6%, will develop severe pulmonary hypertension, probably due to other additional congenital factors. The opening between the atria will also have the potential for paradoxical embolism, although this is relatively rare even in large atrial septal defects. And most of embolic events are rather due to atrial fibrillation in patients with ASD and not due to paradoxical embolism. There are several types of atrial septal defects. The most common form is the secundum defect within the central part of the septum. The primum defect is actually a more complicated and complex valvular heart disease. It's an endocardial cushion defect and always also involves the AV valves. It's in proximity to the AV valves, this defect. And sinus venosus defect is actually not really in the septum. It's up close to the entrance of the superior vena cava. This is the most common form and called the superior sinus venous defect. There's also much less common an inferior type of sinus venosus defect. And the rarest form of atrial septal communication is the coronary sinus defect or unroofed coronary sinus.